Toenail fungus is fairly common, Janice. It affects probably about 10% of the population out there. So, and it's embarrassing to people. I think that's probably the biggest thing people will say. It's just awfully embarrassing. Or they'll even say it's kind of an icky thing to have. They just want to get rid of it. And it's very frustrating for them to have it because it's so difficult to get rid of at times. And it can become painful at times too. So it's nice to have this new treatment that's so much more effective than what we've ever seen before. The treatment is using a laser. And the laser pretty much kills the fungus. It vaporizes it as it's working, and the way it works is basically on a heat principle. It's very much heating up the nail. It heats it up a lot in a very small area, but it does very quickly. It's a pulsed laser, and I use the analogy of like touching a stove really quick. If you do it really quick, it's not going to burn, and that's basically what this does. People tend not to feel it at all. If they do at all, it might feel a little warm, and we just move the laser to another part of the nail. So it's a very pain-free way to go about this. It's very easy. Yeah, in terms of how long we've been doing it and success rate, when this first came out, the initial study was saying it was 88% effective, and that was before I started doing it. And now that I've been doing it it'll be 2 years coming this February, so I've been doing it for quite a while. So I guess you can say I have the out in the field experience doing this, and I feel more comfortable recommending it than ever because I feel very strongly it works very well. Recently, this product got FDA approval for its effectiveness. Before, it was FDA approved for its safety, but it's recently gone through some FDA studies to show that it's very effective too. And it's the first laser of that type in the country. So that's really exciting. The failure rate might only be as little as 10 or 12%. I mean, it doesn't work every time, but that's a very low number, I feel. And majority of cases, it's going to work. And I do feel that it can vary. Some people, if it's just terrible nails, they may only look 60 or 70% better. But the ones that are milder can definitely look like 80 to 100% improved, and I just think that's awesome. So I think it's something that patients have been wanting, and they're very passionate about wanting to get better, and they're very pleased with this treatment. It's just a great service that we can offer to the community here. The benefits of the laser treatment is mainly it's just much more effective. The other treatment options that people are usually looking at would be topical treatment. Topical treatments tend to be very ineffective. Maybe just 10% of the time will they work, and they only work on mild cases. Oral medication using Lamisil has commonly been recommended. A lot of doctors and patients shy away from that, however, because of the liver toxicity, and we're always kind of concerned about our livers. So that's another treatment that's there, but this tends to be more effective than that. And the benefits is it just works, and it's for something that's very frustrating. It's nice to see something that's so much more effective. It's important for your listeners, viewers, to know that this is not a very fast treatment. They're not going to have these clear nails instantly. It takes a while, and we usually have people come back at 4 months. And a lot of times, even at 4 months, you don't see a lot of improvement, but at 9 and at 12 months is when you see the greatest amount of improvement. So, yeah, Janice, the way the procedure works, and somebody comes in, if they're going to have this performed, one of the first things we do is we take pictures. And so we have before pictures, because we're going to take pictures at 4 months and then at 9 months for comparison, and sometimes at 12 months. Another thing that we might do, if the nail is very thickened, we sometimes grind it down a little bit, and this is a very pain-free way to trim some of the debris off the nail, get down to the kind of the main part of the nail. We think that's an important part of the treatment. We have a little grinder device that sprays alcohol and water, so as it's grinding your nail, it tends not to heat up, and it's very pain-free again. And then once the treatment is done, we're just going kind of in a grid manner on each of the nails, kind of at 90 degrees to each other, with the technician doing that. And we do all the nails. That's important for the viewers to understand. If you have 2 nails or 3 nails or 4 that have fungus, we're going to do all 10. And the reason for that is we found out early on, here and out in California where this first started, that if you don't do all the nails, sometimes the clean nails, maybe a year later, will get fungus on them, and then you'd have to come back and do more treatments. So we want to get a clean slate all at once, doing all 10 nails when you come in. Yeah, in terms of safety, this is a very safe treatment option. It's basically just using heat. That's all it's doing. And again, it's vaporizing the fungus. And There's been no side effects that are known that would cause damage to the nail or would cause damage to your skin. So in terms of locations where people can find these lasers, we have our laser here in Fort Collins at the Poudre Valley Foot and Ankle Clinic. We also have an office down in Lafayette and North Denver, and then we also have places in other doctors' offices. We have in Centennial, we have a location there in Littleton, and then in Inglewood, and then also in Colorado Springs. So we kind of have a lot of bases covered here in the state of Colorado to offer this great new treatments. And the